Hello and welcome to today's video, where we will talk about hepatitis A, B, and C. These are three types of viral infections that can cause inflammation and damage to your liver. In this video, we will explain what causes these infections, what are their symptoms and effects, and how they can be treated or prevented. But before we begin, make sure you subscribe to our channel and hit the bell icon to get notified of our latest videos. And if you find this video helpful, please give it a thumbs up and share it with your friends. Hepatitis A, B, and C are caused by different viruses that enter your body through different ways. Hepatitis A, hepatitis B, hepatitis C. Hepatitis A is mainly spread through contaminated food or water, or through close contact with an infected person. Hepatitis B is mainly spread through blood, semen, or other body fluids from an infected person. Hepatitis C is mainly spread through blood from an infected person, such as through sharing needles or syringes. The symptoms of hepatitis are hepatitis B, hepatitis C. Some common symptoms are fever, fatigue, loss of appetite, nausea or vomiting, abdominal pain, joint pain, yellowing of the skin or eyes, jaundice, dark urine, pale or clay-colored stool. However, some people may not have any symptoms at all, or they may have mild symptoms that go away on their own. This can make it hard to diagnose the infection and to prevent its spread. Hepatitis A usually lasts for a few weeks to several months. Most people recover completely without any complications. However, in rare cases, hepatitis A can cause liver failure or death. Hepatitis B can range from a mild illness that lasts for a few weeks to a serious chronic condition that lasts for a lifetime. About 90% of adults who get infected with hepatitis B clear the virus from their body within 6 months. However, about 10% of adults and up to 90% of infants. This means that the virus stays in their body and can cause liver damage over time. Chronic hepatitis B can lead to cirrhosis, liver cancer, liver failure. Hepatitis C can also range from a mild illness that lasts for a few weeks to a serious chronic condition that lasts for a lifetime. About 15% to 25% of people who get infected with hepatitis C clear the virus from their body within 6 months. However, about 75% to 85% of people who get infected with hepatitis C develop chronic hepatitis C. Chronic hepatitis C can also lead to cirrhosis, liver cancer, or liver failure. The good news is that hepatitis A, B, and C can be treated or prevented with proper medical care and lifestyle changes. Here are some ways to protect yourself and others from these infections. For hepatitis A, there is an effective vaccine that can prevent the infection. The vaccine is recommended for children aged 12 months or older, travelers to areas where hepatitis A is common, people with chronic liver disease, men who have sex with men, people who use drugs, and people who work with animals or human waste. For hepatitis B, there is also an effective vaccine that can prevent the infection. The vaccine is recommended for all infants at birth, children and adolescents who have not been vaccinated before, people at high risk of exposure such as healthcare workers, people with chronic liver disease, people who inject drugs, men who have sex with men, people who have multiple sexual partners, people who travel to areas where hepatitis B is common, and people who live with someone who has hepatitis B. For hepatitis C, there is no vaccine available yet. However, There are new treatments that can cure more than 95% of cases of chronic hepatitis C. These treatments are usually taken as pills for 8 to 12 weeks. They have few side effects and high success rates. It is also important to eat a healthy diet rich in fruits and vegetables and low in fat and salt. The treatment is recommended for anyone who has chronic hepatitis C. For all types of hepatitis, it is important to avoid alcohol and drugs that can harm your liver. However, these remedies are not a substitute for medical care and should be used only under the guidance of a doctor. It is also important to avoid sharing needles or syringes with anyone else. There are some natural remedies that may help treat hepatitis, which is a viral infection that causes inflammation and damage to the liver. It is also important to exercise regularly and maintain a healthy weight. For all types of hepatitis, it is also important to practice safe sex by using condoms or dental dams every time you have oral, vaginal, or anal sex. It is also important to avoid sharing needles or syringes with anyone else. There are some natural remedies that may help treat hepatitis, which is a viral infection that causes inflammation and damage to the liver. Some of the natural remedies that have been suggested for hepatitis are milk thistle. This herb contains a compound called silymarin, which may have antioxidant and anti-inflammatory effects on the liver. Some studies have shown that milk thistle may help protect against liver disease progression, prolong life in people with alcoholic cirrhosis, and enhance overall quality of life in people with liver disease. However, other studies have found no benefit of milk thistle over placebo squared. Milk thistle is generally safe and well tolerated, but it may interact with some medications. Ginseng. This herb has anti-inflammatory properties and may help protect against liver injury caused by viruses, toxins, or alcohol. Some animal studies have shown that ginseng can reduce liver fibrosis, inflammation, and oxidative stress. However, human studies are limited, and more research is needed to confirm its effectiveness and safety for hepatitis. Zinc. This mineral is essential for liver and immune system function. However, zinc should not be taken in excess, as it may cause side effects such as nausea, vomiting, diarrhea, and copper deficiency. Vitamin D. This vitamin helps regulate immune system activity and inflammation. People with hepatitis C may have low levels of vitamin D in their blood, which may increase their risk of liver damage and complications. Some studies have shown that vitamin D supplementation may improve liver function and antiviral response in people with chronic hepatitis C. However, more evidence is needed to support its use for hepatitis. Yoga is generally safe and beneficial for most people, but it should be done under the supervision of a qualified instructor who can modify the poses according to the individual's health condition. These are some of the natural remedies that may help treat hepatitis. Early diagnosis and